Okay. Hi, everyone. Thank you for joining us today for the National Research Collaborative for Foster Alumni and Higher Ed web series for our next webinar today. I'd like to ask everyone to please keep your videos off during the webinar today. And we will be using the chat box for questions. So if you have questions, feel free to type those into the chat box. And at the end of our presenter's time, I'll read those questions out and have her respond to those. Just to make sure all of you know, we record all of our webinars and we make those available on the NRC FAHE website soon after it occurs. So you can find all of our past recordings there if you're interested. So again, this is part of the National Research Collaborative for Foster Alumni and Higher Ed webinar series. My name's Amy Salazar. I'm an assistant professor at Washington State University in Vancouver, and I am part of the leadership team of the collaborative. And thank you all for joining us today. Before we get to today's webinar, I just wanted to tell you all about our next upcoming webinar. Our May webinar will be held on Thursday, May 30th. From 11 to noon Pacific time, which is 2 to 3 Eastern time. And our presenter will be Fred Kingston. He's the program manager of statewide initiatives at the state of Washington's College Success Foundation. His presentation, entitled The Washington Passport Network, Leveraging College Impact, will discuss how Washington State has set an impact goal of parity in educational outcomes for foster youth and their non-foster peers by 2027. And he'll tell us all about the Washington Passport Network, which is a statewide collective impact initiative supported by the College Success Foundation. And he'll talk about how that's working at individual, campus, regional, and the statewide level to promote effective practices and policies for supporting youth in care and meeting their higher education goals. So if that sounds interesting and you haven't joined already, please be sure to register for that when you have a chance. Okay, so just a little bit about our webinar today. Our presenter will have about 35 minutes for their presentation, and then at the end we'll open it up for some discussion or for some question and answer. And as I said, I will do the question and answer through the chat boxes, so please be sure to type those in. You can type them in as we go, but I will wait till the end of the presentation to answer those. And if you're joining us by phone and you don't have access to the chat box, you could also email me any questions you have on my email address, which is amy.salazar@wsu.edu. That's amy.salazar@wsu.edu. Okay, so let's get to our presentation today. Our presenter today is Toni Watt, and she's a professor of sociology at Texas State University. Her research is both academic and applied and focuses on improving outcomes for children and youth who've experienced trauma and or the foster care system. Dr. Watt is currently conducting an evaluation research on FACES, the Texas State University Support Program for Foster Care Alumni. And she's also a member of the Education Research for Texans Research Collaborative, a group of researchers investigating ways to improve higher education outcomes for youth who've experienced foster care. So, Toni, I'll hand it over to you.
Okay, great. Thank you, Amy. Good afternoon, everybody, or good morning, depending on where you're located. Thank you for attending the webinar. Amy, let me make sure I can get this shared, and let's see if we can get the presentation up first, and then I can get started. Let's see. Okay, starting out great, trying to get this going, not seeming to get it up. Let's see, so if I click on, Amy, maybe you can help me.
Do you see a share or new share button, share screen?
It says we'll stop screen sharing. Do you want to?
That's fine, continue.
Continue, okay. But I'm still not getting anything coming up.
Oh, that's too bad. Okay, well, I could share your screen for you if there's some I'm not sure why it's not working.
Okay. Yeah,
Do you want to try one more time? I just stopped sharing my screen.
okay, let me try.
There we go.
Maybe here we go. Okay. Okay, finally. Does everybody got that? Does that look clear to you, Amy?
It does, yeah.
Okay, great. Thanks everybody for coming. I appreciate you being here, and I want to thank Dr. Salazar and the NRC FAHE leadership team for putting on such a wonderful webinar series and allowing me to participate in it. I really appreciate it. What I'd like to share with you today is a little bit of the research that I and some other people have been working on to try to explore the impact that state tuition and fee waivers have had on higher education outcomes for youth who've experienced foster care. And as you can see from the title of my talk, it's called "But I Thought They Had a Free Ride: Exploring the Benefits and Limitations of State Tuition Waivers." And the reason I chose that title was based on a conversation that I had with a colleague not long ago in my department. I was telling him a little bit about some of the work that I do, trying to evaluate the campus support program that we have here at Texas State, trying to share that information with other colleges and universities across the state, and also trying to get legislation passed to increase supports on college campuses for youth who've been in care. And as I was telling him about that, he said, "Well, why are you working on all of that? I thought these students had a free ride." And what he was referring to is the fact that in Texas, there is a tuition and fee waiver for youth who've been in foster care. And his comment really struck me because it made me realize that he had made an assumption that if there was a tuition and fee waiver, that youth who've been in care must have already achieved parity with their non-foster peers in terms of higher education outcomes. And if he, someone from my own field, thought that, I wondered how many other people might be having that kind of assumption. What about college or university administrators? What about state legislators? Might they think that a tuition waiver is all that needs to be done? And if they do assume that the waiver has had a dramatic impact, how might that be influencing their support for other kinds of initiatives like campus support programs or other types of legislation? So it really made me want to dig in and better understand, have the waivers had this significant impact, at least to the extent that some people seem to assume that it has. So one of the first things I learned is that we don't have a lot of research on this subject. And I'll tell you a little bit about what we do know in just a second. But just to give you a little bit of background, there are 23 states currently that have tuition and fee waivers. And of course, there are some that estimate it at more than that, but some of those states have what are more likely to be defined as scholarship programs instead of waiver programs. But 23 states is a pretty good estimate. Texas was one of the first states to develop this waiver program in 1993. We were the second state behind Florida to do so. And you can probably look on the map here and see a little bit about what some of the states look like. In blue are the ones with the waiver programs. But unfortunately, we did not have much research on whether these waivers were effective. I could not find any studies even before 2017, no academic studies, and certainly no agency or state evaluation data on the waivers. But fortunately, there was a great study on waiver implementation that came out in 2017, conducted by Hernandez, Day, and Henson. I think you might be familiar with some of these people. And they did a fantastic descriptive study. They looked at the eligibility criteria for the states that had waivers at that particular time, which were 22 states. And they found that the eligibility criteria for the states with waivers varied dramatically from state to state. Some states had programs that were defined broadly so that a lot of youth qualified for the waivers. Some youth had very narrowly defined waiver programs so that not many youth qualified. And consequently, the number of waivers distributed by state varied dramatically. So for example, Texas has a very broadly defined waiver eligibility program so that in the year that they examined, which was 2014 to 2015 academic year, Texas distributed over 3,000 waivers to youth who'd been in foster care. They also found, though, that 16 states distributed less than 500 waivers, and that 9 states distributed less than 50 waivers in that same time period. So, and some of those states, for the 9 states in this category, were really small waiver distributions. Some of them distributed 8 waivers, 17 waivers, 20 waivers. Now, most of these states are smaller than Texas, of course, but I think it's pretty clear that any state that distributes 8 waivers or 10 or maybe even 50 is not developing a strategy that has the potential for broad impact in terms of higher education outcomes for youth who'd been in care in those states, and certainly not nationally. And you can see at the bottom here is just the citation for that study if you want to take a look at it. It was really a fantastic examination of the implementation of waiver programs by state. And it laid the foundation for asking this question of, if these states vary so much and many don't distribute many waivers, then have tuition waivers dramatically impacted outcomes? So I want to tell you a little bit about some of the research that we've been working on in Texas to try to determine that. The first one is a study that's a national study. I worked on this with some of my colleagues at Texas State, and we used the National Youth in Transition Database. I'm not sure if you're familiar with it, NYDID as we call it. It is an outgrowth of the CHAPI Foster Care Independence Program, which required that states document the services provided to youth in care and track their outcomes. So the way they did this is through a survey research project, and this is the transition database. And this is a little bit about how it's done. The states then do survey research with the people who turn 17, or youth who turn 17 while they're in care, and then they get some information on those youth again through survey data. And then they track them by following up again, and at age 19 conducting another survey, and then at age 21 conducting another survey, particularly looking at outcomes. And there are a number of different outcomes that they examine. They look at educational outcomes, employment, reports of things like homelessness or experience with incarceration. For this study, we focused on the data that could tell us about higher education outcomes and that offered an indication that these youth had enrolled in higher education at some point in the follow-up period, looking at vocational schools, community colleges, or four-year universities. And we wanted to look at that higher education enrollment and how it might vary for states with and without tuition fee waivers. And we were looking at those states who might have waivers at least by 2012 for that particular time period. And of course, when we compared these two broad groups, we would need to control for the fact that these states differed on a lot of other characteristics as well. So we tried to control for things like gender differences, race, ethnicity differences, and then some other state differences, like differences in the poverty rates by states, differences in the higher education enrollment rate by states, and that type of thing. And this is the publication that came out of that in 2018. So I want to share with you just a few of the findings from that study. First of all, we looked at the higher education enrollment rate overall for these data, and the data showed that about 32%, or about a third of the youth, according to NYDID, enrolled in higher education at some point in time. Now, the NYDID database has a lot of strengths. It's national data, it's panel data, and it's current data. But of course, there are limitations in the measures and limitations in terms of some of the follow-up rates, but this estimate is pretty consistent with other national estimates as well, or other estimates from other regions. So I think it's a useful starting point. But what we really wanted to know is, does this rate vary for states with waivers versus those without? And the next slide is just a very simple comparison of that finding for you. So what you can see from here are two columns. The first column represents for foster care alumni in all the states that do not have a waiver, and that enrollment rate is about 32%, 32.5%, and that is compared to the foster care alumni in all the states that do have waivers, which is almost the exact same percentage, about 32%. So the enrollment rates for states with and without waivers are almost exactly the same. Now, what you can see from the vertical lines those are the ranges for the states. So what that shows us is that the states vary dramatically within each of these categories. Some states have pretty low enrollment rates around the teens, and some states have enrollment rates that are quite high, upwards of around 50%. And so there was a lot of variation within these different categories. And that fits with the Hernandez, Day, and Henson study that showed that the waiver programs really vary dramatically. So it wouldn't surprise us that so would the enrollment rates. What we wanted to do, of course, is see if we could see differences in the states when controlling for other kinds of differences between the states. So we did do multivariate analyses. And this slide just gives you a very brief summary. The findings were fairly complicated in some ways, in that we saw that once you control for some of the differences in the states, there was a slight difference. States with tuition waivers had about a 12% higher enrollment rate than states without the tuition waivers. But this actually was what we found to be a directional difference. I'm not sure if we have a ton of researchers on the call or not, but for a difference to be statistically significant, it needs to typically be 0.05 or less. This was what we call directional because it was just slightly over that, meaning we wanted to go ahead and report it, but it wasn't even quite significant. And then as we looked into it, part of the reason for that was because that, again, this effect is really small. There's a lot of variation across states. There's clustering in states. So really our broad conclusions, even after the multivariate analysis, were that the states with waivers don't substantively differ from those without waivers in terms of their higher education enrollment rates. So we felt like that was a decent starting point, but of course it was a problematic analysis because the states vary so much that it was hard to compare them. So what we really wanted to do is dig more deeply into what was going on in Texas, because Texas is one of those states that has had a waiver for so long and distributes thousands of waivers. So we thought if there was ever a state where the waiver would have had an impact, it would be Texas. So the next study that I want to share with you comes from using Texas data. We were really fortunate that in 2017, the Texas legislature mandated that the Department of Family and Protective Services and the Texas Higher Education Coordinating Board begin to track higher education outcomes for youth who'd been in foster care in the state. And this was a fantastic new development for us because we hadn't had anything like this in terms of data in the past. So in 2017, they did just that. They created a data set matching their records that represented a cohort of youth who'd been in foster care at some point in time in Texas and who turned age 18 at a certain year. I'll share with you the time frames in a bit. And then they followed those youth from age 18 to age 24. And then they looked at the academic data on higher education outcomes. So they were able to pull records that let us know, did that youth ever enroll in higher education? What were the retention rates, their GPAs, and their graduation rates as well. So this was a really unique data set that we were really excited to have developed in Texas at this time frame. So there were two phases for this analysis of Texas data, and the first phase was when they pulled this data set the first time in 2017, and the cohort that they looked at was youth who turned age 18 in 2009, and then they followed them for 6 years. That produced a data set of 3,855 youth. And they did have measures of whether the youth used the waiver, but unfortunately in this first data pool, they did not have a measure of whether the youth was eligible for the waiver. And not all youth in this cohort were eligible for the waiver. I'll tell you a little bit about the eligibility criteria in a bit. But so there were some limitations to the data that did get pulled this first time. And also, DFPS conducted the analysis. They did some basic univariate and bivariate analyses and some descriptive statistics, and we were fortunate that they allowed our research team to have access to those aggregated statistics and allowed us to publish them in 2018. So the study listed at the bottom of the slide is where you can see the citation for the research that we published on this particular phase. So we were really happy that they let our research team have access to this, and I want to go ahead and thank my collaborative partners in Texas on this project. If you'll see, the co-authors on this paper are Drs. Faulkner, Bustillos, and Madden, and they are part of the Education Reach for Texans Research Collaborative. I also want to thank the chair of that collaborative, Dr. Christine Norton, who is my partner in all this work at Texas State. I'm really grateful that we have a group of researchers from across the state that are working on this subject together. They're really talented and dedicated located, and I think some of them might be on the call, so I wanted to give them a bit of a shout out. But anyway, so we were happy to have the data, and we published some of the results, and I'll be sharing with you a little bit of that. But one of the things that we really wanted was to have access to the individual level data so we could dig more deeply into the data, do more detailed analyses, learn more. So with about a year of negotiation, we have been working to try to get access to the second poll that occurred, which occurred last year in 2018. And so this time they pulled another cohort, which were youth who'd been in foster care who turned age 18 in 2010. They were followed for 6 years, and that produced a data set of about 4,263 youth. And this time we did get not only waiver use, but waiver eligibility, and we have access to the individual level data. But this analysis is currently underway and in progress. I was hoping to have all of this polished in time for the webinar, but as many of you know, trying to sort of get MOUs signed by 4 state agencies took longer than I thought. So we are in the middle of that analysis, but we have not published any of those data yet. In fact, I haven't even shared it with some of my collaborative partners yet. So everybody will be seeing it for the first time today. So what I want to do in the next few slides is share with you a little bit of what we learned in phase 1 that is published, and then on some of the slides that have an asterisk on them, there'll be some of the findings that we are just now getting into that haven't been published, are very preliminary, but that we are excited to share with you today and to talk about. And again, what's really great about this data set is, unlike the NIDED data, it's actual academic data. With NIDED, there are concerns in the National Youth and Transition Database with the fact that you're doing survey data, and very often it's hard to locate the youth to do the follow-up surveys. And in fact, in NIDA, the follow-up response rates are only about 54%. So you're interviewing a lot of the youth, but there are a lot of youth you can't locate, and you have to wonder whether the youth you can't find are somehow different than the youth that you can find in this survey follow-up study. But here, this is academic data. So we are able to know for every single youth in this study whether they did enroll in college or not and what the outcome of that was. Now, I am definitely not going to read this to you, but before I provide you the data, I just wanted you to be able to take a look at the eligibility criteria for Texas. And again, I think in a nutshell, what this tells you is it's complicated. There are a lot of youth who qualify for the waiver, but it's really difficult to sort of explain it succinctly. But this is basically what is involved. So I can tell you that if you look through this, what you will see is that all youth who emancipate from care, who age out of the foster care system, are eligible for the waiver. Many youth who are adopted are eligible, but it all depends on the timing of that. Many youth, particularly those who end up being placed with relatives in kinship care, are often not eligible. So again, it's broadly defined. Lots of youth are eligible, but there are also many subgroups that are not, and I'll give you more information on that in a bit. So this is the slide that gives you the basic summary from phase 1 published analysis of the higher education outcomes for the youth in this cohort. So what you can see here is that about 3.6% of the youth in this data set have achieved a post-secondary credential by age 24. And the breakdown of that is below. About 1.5% have achieved a bachelor's degree, 0.5% have achieved an associate's degree, and 1.5% have achieved a vocational certificate. So obviously these numbers are low. We were quite disappointed to see these numbers, with Texas having had a waiver for 25 years, distributing thousands of waivers. We certainly hope for more than 3 to 4% having a post-secondary credential by age 24. And those are the kinds of numbers that we consistently see, and I think everyone wants to see go up. But even though we were disappointed to see these low post-secondary achievement rates, we were happy that we finally had the data so that we knew what these outcomes were. We can track them over time, and we can begin to try to understand what's going on. So I just want to share with you a little bit of what we're learning about. First of all, this slide shows the enrollment rate in Texas for this cohort that we published in that first study that shows that about 33% or about a third of the youth in the study did enroll in higher education. Now, this is very consistent with the estimate from NIDED. We were, again, hoping that it might be a little bit higher, but it's still a large percentage of youth that are enrolling in college. So we were asking ourselves, if almost a third enrolled, then what happens along the way that leaves only 3 or 4% of them to end up with a post-secondary credential? So this is what we're trying to understand. The one thing that we did learn is that of the youth in the study, 39% of them were eligible for the waiver and 61% of them were not eligible for the waiver. So it is important to note that over half of the youth in this data set can't access this resource because they are not eligible according to the criteria. But on the other hand, you can say, well, but 39% is a pretty large number. So there are thousands of youth who are eligible. What happens to them sort of along the way? Now, this chart shows you the enrollment rates and how those might vary for those who are eligible versus those who are not eligible for the waiver. And what you can see is that of the youth eligible for the waiver, 44% of them enroll in higher education compared to 31% of those who are not eligible for the waiver. So we felt like this was an indication that the waiver might be increasing enrollment rates and that it might be bringing more youth to college than would otherwise apply because these were significant differences here. But then again, we were trying to understand, well, what happens? So this chart is the chart that probably surprised us the most, which was that among the youth who enroll in college and who are eligible for the waiver, 41% of them do not use the waiver. And this really surprised us of why such a large percentage of youth would not use the waiver if they were eligible for it and were enrolled in college. We can think of absolutely no reason that a youth would not want to use the waiver. There doesn't seem to be any situation in which it would be advantageous for them to opt out of the waiver and to do something else. So we wanted to understand what relates to waiver utilization, who's using it, who's not using it. And so in this preliminary analysis that we've been just working on very recently, we looked at some of those relationships. And what we found were that there were some factors associated with waiver utilization. Waiver utilization was higher in four-year universities compared to community colleges. So that might give us some indication of a need for possibly more campus support initiatives on community colleges to work on this. We also saw that those who completed high school were more likely to use the waiver than those earning a GED. So we suspect that maybe youth who get a GED are confused about whether they still qualify for the waiver. So that is something we could educate them on. We also found that youth who emancipated from care used the waiver more than other placement types, and that those who received PAL or preparation for adult living classes were more likely to use the waiver. And those last two things might be related because we know the emancipated youth are probably more likely to get PAL classes where they are taught and formally instructed about the waiver and the waiver process. We also saw that there were some factors unrelated to waiver utilization. One was gender. Another was race and ethnicity. And then a final one was college GPA. And this latter one really interested us because it was suspected that, well, maybe the students who are the most academically prepared or the most dedicated to pursuing a college degree were the ones most likely to use the waiver. But at this preliminary analysis, we didn't seem to see that the strongest students used the waiver or the weakest students didn't use the waiver. Right now, it seems to be not related to their college performance. And so one of the things that we want to do when we move forward is try to understand what are some other reasons that youth aren't using the waiver. We've heard anecdotal evidence of things like possibly that youth don't realize that they are eligible. Of course, that's possible for particular placements or, as I said, with the GED. We also felt like it might be that they know they're eligible, but they find the application process too confusing and too daunting, and so they don't apply. And we've also more of a concern, heard that some colleges and universities might be uninformed or misinformed about the waiver and may not be giving students accurate information about whether they are qualified or how to apply. Now, again, none of that can be verified, but we've just heard these stories. So if you have information about sort of waiver utilization in your state or how that works or how to improve it, we'd love to talk about that. We will be doing more analysis with these data to try to understand how campus support programs relate to waiver utilization, because obviously all of those problems are problems that could be addressed with a campus support program. So that was one thing that we wanted to look at. Now, the second thing that we were concentrating on is trying to understand how might the waiver relate to academic outcomes. I mean, this assumption that we need to get the waiver to more students is based upon the idea that if students use the waiver, they will do better in college, be more likely to stay, be more likely to graduate. But again, there's never been any evidence of that or evidence to suggest how much of an impact does the waiver have on academic outcomes. However, in our very first study, we did see some indication that the waiver would be associated with higher enrollment, retention, GPA, and graduation rates. But again, those analyses were aggregate statistics, only bivariate analyses, pretty simple analyses, and we just weren't sure that these kinds of findings would hold when we did more detailed or more sophisticated analyses. But that's what we found. So in this second phase, where we are now working with the individual level data, we just preliminarily can try to dig into this topic. And I'll share with you just a couple of slides to tell you what we're learning. First, this is a slide that shows you a subsample of youth. It's the youth who enrolled in four-year institutions and who were eligible for the waiver. Only those youth, again, who were in four-year universities and who are eligible for the waiver. The pie chart on the left side are those who use the waiver, and the pie chart on the right side are those who do not use the waiver. And then you can see the graduation rates there. So the youth who use the waiver, among those youth, 24% of them graduated, and among the youth who did not use the waiver, only 6% of them graduated. And so obviously the youth who used the waiver had much higher graduation rates. And again, these are all waiver eligible youth. So we felt this was a really encouraging finding that the waiver might be able to have a significant impact on academic success. Now again, this is a very simple analysis, but we also have done some multivariate analyses of this to try to control for other differences that might exist between the students who use the waivers and those who don't. And in this multivariate analysis, what we found is that the youth who used the waiver were 3.5 times more likely to graduate with a bachelor's degree than the youth who did not use the waiver. And that was controlling for gender, race, ethnicity, waiver eligibility, and GPA. And again, as I mentioned, we were particularly interested in controlling for GPA because it was thought that perhaps those who use the waiver were stronger students, and that might explain the better outcomes. But we see this large impact of the waiver even when you control for that academic performance. So we thought this was a really encouraging piece of data, and we're going to continue to study this and make sure that these findings hold as we look more closely. But I'd like to share with you just one more slide from some of our data on this subject, which is to point out that if you think back to those pie charts, the youth who enroll in college are waiver eligible and use the waiver had graduation rates that were 24%, which was much higher than for the youth that didn't use the waiver. But this is still a low graduation rate relative to the general student population in Texas, which is about 49%. So it's less than half the graduation rates that you might see for non-foster youth. So again, if youth enroll in college or eligible for the waiver and use it, we're still seeing only about 1 in 4 being able to achieve that degree, even when utilizing those kinds of resources. And so there's a lot more to be done to achieve parity. So I just want to summarize some of the data that I've just presented a little bit for you of, what it means to us here in Texas. Now, of course, I want to point out that all of this research has limitations. As I said, the NIDed database has limitations. The Texas data has limitations. So none of these studies conclusively show whether tuition and fee waivers have had an impact and to what extent they have moved the needle in terms of higher education outcomes. But I do think they offer some useful information that we've not had up to this point, some data to inform the discussions about tuition waivers, whether they're working, and where we need to go from here. So just to summarize, we believe these data tell us that the waivers can improve higher education outcomes. In the Texas data, we see higher enrollment rates, retention rates, and graduation rates for the youth who use the waiver, even when controlling for a number of different factors. So I think there can be benefits, and some of the benefits we're seeing are large. However, consistent with our research and the other research that's been done by Hernandez Day and Henson, the waiver programs vary so dramatically that it's unlikely that every state with a waiver is going to see a large impact, because many states have narrowly defined waiver programs, and so they don't distribute a lot of waivers because of the criteria. And then some states like Texas have broadly defined programs, but they have not necessarily been attended to the execution to where they made sure that all the youth who are eligible for those resources are accessing those resources. So there's a lot of work still to be done at the state to make sure that the waiver programs are well designed and well implemented. And finally, even if waivers can have a significant benefit, they are not a panacea. Graduation rates are still low for the youth, even those who use the waiver. And what that tells us is that additional supports are needed to achieve parity. So this sort of goes full circle back to the beginning of my talk, where we were saying, well, I hope people don't assume that the waivers are all you need to do, because that may not be the case. And in fact, these data suggest that that waivers have been helpful, can be very helpful, but that they aren't the only thing that needs to be done, that much more is needed. And so I think the implications for research and practice are probably pretty clear, but I'll just talk about them briefly here to wrap up. If those of you who are in the audience are involved in policy or in contact with your state legislators and your state has a tuition waiver, you might want to encourage them to evaluate their waiver programs and attend to their execution to make sure the waivers are being utilized. If you are in a state without a waiver program, some of these data might be helpful to make the case for waivers, because they can give an indication that waivers can improve graduation rates, substantively improve them. And then finally, I know many of you on the call are working diligently on other kinds of programs, campus support programs in particular, either as researchers or practitioners. And so I just want to encourage you to continue all of that good work, to know that it is needed and really important, and that it's important to evaluate those programs. Just as with the tuition waivers, we cannot assume that things that sound like they should work are actually working. So I hope that you will evaluate your programs. I know there have been some evaluations so far at Education Reach for Texans last year at our convening. Liliana Hernandez and Angelique Day presented an evaluation of a program called TIP, and they had really good outcome data, and they shared with us how certain components of the program were more likely to improve outcomes than others. And that's the exact kind of evaluation I'd love to see more of, and hopefully we can see more of that study and others like it. I know the next steps for us with this Texas data is that we are going to evaluate whether universities and colleges with campus support programs have not only higher waiver utilization rates, but also better outcomes. So that's what's on the docket for us in the next couple of months. So I hope you will evaluate your programs. And in particular, I think there are 3 areas that I'd love for us to have more in-depth discussion about what campus support programs are doing and whether they work or not. One is in the area of additional financial support, particularly for housing. I know that there are supervised independent living programs that are being implemented, and that some of you are working on evaluating those, so I hope to hear more about that. Also, I'd love to know if you're working on anything related to academic performance. I know from our data at Texas State and in the general state data that even when youth who've been in care graduate, their GPAs are still pretty low. I know at Texas State we tried to help students by referring them to campus resources, but their GPAs are still low, which makes them vulnerable in terms of meeting the standards for satisfactory academic progress. So if you have something around academics, it would be great to learn more about that. And finally, the area that I'm particularly interested in, because a lot of my research focuses on mental health and evaluating mental health interventions, I'd love to see more about mental health programs on campuses. I know that at Texas State, even though we have a support program and social support, and we refer students to the resources on campus and the counseling program, we've had students who use the waiver, who are stable financially, who are academically excellent. We've had students with GPAs of 3.5 and above, close to 4.0, and that we've seen that at some point in their college career, a mental health challenge emerges, sometimes unexpectedly, and can completely derail their progress and sometimes lead to dropout. We're still struggling with how to help those students, how to maybe prevent things from getting to that point. Again, as I said, we have social support, we have campus, counseling center, but most campus counseling centers are overworked. I know that in Texas, there's one counselor for every 1,500 students in most college campuses, and Texas State is very similar. I also know that a lot of counseling programs may be trauma-informed, but some might not, and even if they are trauma-informed, that doesn't mean that they offer trauma treatments. So youth who've been in care have complex trauma histories. They often have a lack of social support. And I'm really interested in what you might be doing around mental health to address those unique issues. So that's about all I have for today. I just want to thank you for attending, and I want to thank you for all the great work you're doing. I'm following along on a lot of your research and your webinars, so I look forward to more of your quantitative and qualitative research studies. And for those of you who are practitioners, I love hearing about what you're doing, and I hope that if not today, later on you can share with us some of your case studies, sometimes learning about what students are succeeding and what that looks like, and what students are dropping out and why that might be, really gives us a lot of depth and detail to some of the kinds of sterile numbers that I've been working with. So we're about to open it up for comments and questions. I'd love to hear about some of that, or you can contact me later on, or maybe do an additional webinar. But anyway, thank you for all your great work and for your time. And I want to thank once again the NRC, FAHE, and the leadership there for giving us the opportunity to share information and ideas about this topic. So thank you very much. And with that, I think we can open it up to comments and questions.
Thank you so much, Toni. That was great. I appreciate it. So now's the time, if you have questions, please go ahead and type those into the question box. If you want to, if you have something that you don't really want to type into a question box but you'd like to tell Toni about, maybe something that's doing in your site, you could use the raise the hand function and I can take you off mute. And again, if you are joining us by phone and have a question and want to email it to me, my email is amy.salazar, salazar@wsu.edu. So I'll give everyone a minute to type those questions in, and I'll read those out loud to our presenter. So one question that I have here has to do with community college. So we were bringing up the fact that it looked like less was happening with the community colleges, and that we know that a lot of youth in foster care are more likely to start off at community colleges. So is there anything happening in that area of work to get community colleges more involved?
Yeah, I think in Texas, I know we were definitely working with community colleges and four-year universities, not only individually, but also to help them have bridge programs. I know Texas State works with some other community colleges so that we can try to help identify the youth that do want to transition and help them have a bridge over. And we've had some really successful experiences with students doing just that. So yeah, I think I think bridge programs either from high school to college and from community college to four-year university are really important things to develop, and we're working on that for sure here in Texas.
Great, thank you. Another question is if you could tell a little bit about your campus support program. And I think you touched on that a little bit, but maybe just saying a little bit more about what your campus support program does.
Oh, yes, absolutely. I'd love to share that with you. Our campus support program is called FACES, Foster Care Alumni Creating Educational Success. We started it in about 2009, 2010, and we initially had a grant, a TG Public Benefits grant to develop it, where we got to sort of do a lot of what we wanted to because we had that grant funding. And again, that is Dr. Christine Norton and I worked to develop that in conjunction with our Office of Retention at Texas State. And so the program has, Dr. Norton has been the program coordinator, and the model is having social work graduate students serve as advocates for the youth on campus. So they meet with them whenever they need assistance, whether it is to help them apply for ETV funds or whether to help them apply for the waiver or just to check on how they're doing with their classes or have coffee with them. So the advocates have been, to me, a really critical part of that program. We also have one-on-one mentoring. The university has a mentoring program in general, but what we've done is sort of take that program and then make sure that the mentors with the university who are assigned to the youth in the FACES program also have additional training on foster care and trauma and issues of that sort. So there's a one-on-one mentoring program for faculty and staff to assist the students one-on-one. We have a student organization, and the student organization actually chose the name, and they are very active on campus, and they support one another, and we're really proud of them. They do a lot of community work. They do outreach to youth who are currently in foster care and serve on panels when these youth come to tour the university. And I can brag that now one of our FACES students, Corey Benbow, is the student body president of student government at Texas State University, which is fascinating because this is a university with 37,000 students, and we have about 134 youth who are in foster care, and Corey is one of them, and now he is the president of the student organization for this large university. So we really are seeing the students emerge as leaders and helping one another and helping other youth as well. So that's just a little bit about our program. And we also published a study in 2013 in the Journal of Children and Youth Services Review, if you want to look at that, where we describe the program in great detail and we provide quantitative and qualitative data on processes and outcomes. And our outcomes have been pretty great. Our graduation rates, we track them every year, so they do vary a little bit with the sample size, but they hover right around 50%. I think the last estimate was around 48%.
Wow, that's great. One other question is, do you have any tips for people who want to work with their state to get data on foster youth tuition waiver use?
Wow. I mean, you know, someone else might be able to answer that question even better than I am, because I am a complete newbie in terms of working with the state government. It's something that's not really in my wheelhouse and I find terribly intimidating. But I'm just now getting into it, and I know there are a lot of people who work in this area more and more. I mean, of course you can write your legislators and ask for this kind of information. You can, I think the coordinating boards and DFPS can begin to sort of request you know, this kind of legislation, although it is an unfunded mandate that they had to pull this data, but they did do it. And so I think it's really important just to let them know that if you're going to legislate this waiver, you know, it's an important responsibility to find out whether it's working or not. And so again, I'm not the expert in working with the policymakers, but I know there are people on the call who could probably chime in.
Well, we don't have anyone chiming in, but maybe we'll just leave it at that and leave that as our thing to think about. So I don't have any other questions coming in, but so I think we'll wrap up now. But thank you so much, Toni. I really appreciate you sharing the data that you've been working with us today.
Well, great. Thank you for allowing me the opportunity to speak with everyone. And I am just, again, really excited that we have this national collaborative so that we can talk and share ideas. So thank you once again, and thanks to everyone who attended today.
So thanks everyone for coming, and just as a reminder, we'll be posting this recording and the PowerPoint along with all of our other webinars on the website soon. And please be sure to register for our May webinar if you haven't already. Thank you so much.
Thank you.